All right, Carolyn, in today's health alert, Lyme disease cases are climbing across Michigan, with 215 new cases reported in the last 4 weeks. As tick season reaches its peak, health officials are urging people to be extra careful when spending time outdoors. Our chief health editor, Dr. Nandi, joins us now. Thank you for being with us. So where are people most likely to encounter ticks, and then how do you know if you've been bitten or infected?
We're hearing all about this. My patients, we were talking about it. Ticks are most commonly found in grassy, brushy, or wooded areas, Mike, and they can also be seen in parks, along hiking trails, even in your own backyard. In Michigan, in fact, black-legged ticks, also known as deer ticks, are the main ticks that are spreading Lyme disease. Now, tick bites are often painless, and depending on their life stage, ticks can be as small as a sesame seed. They can look like a small dark spot or a bump attached to your skin that wasn't there before. And ticks, what they do is they bury their heads into your skin, and if they're large enough, you can see the little tiny legs move when they're touched. As for signs of infection, these can develop anywhere from 3 to 30 days after a bite. And early symptoms may include fever, chills, headache, fatigue, muscle ache, joint pain, or swollen lymph nodes. There's a classic bullseye rash that may develop, Mike, but not everyone gets one. It may simply look like an expanding area of redness. If Lyme disease isn't treated, this is important, it can lead to more serious problems like facial paralysis, severe joint pain, heart issues, and even nervous system complications.
All scary stuff. So if you are bitten, do you need to go straight to the emergency room? And then, what can people do to protect themselves?
Important question, right? So most people do not need to rush to their doctor, to the ER or your doctor's office. What's most important is this, is to remove that tick right away. Use fine-tipped tweezers, grasp the tick as close to the skin as possible, pull that sucker straight up, do not twist it, crush it. Don't try those home remedies like petroleum jelly or a hot match. People do all kinds of crazy things. After it's out, clean the area with soap and water or rubbing alcohol. Now, the reason you should not wait is that removing a tick within the first 24 hours can significantly reduce the risk of tick-borne illness. That said, if you develop any symptoms I mentioned earlier, you should contact your doctor or healthcare provider. As for prevention, please use an EPA-registered insect repellent. Stay on cleared paths when hiking, and wear long sleeves and pants when you're in wooded or grassy areas, even when it's hot. Once home, check clothing, gear, and pets as well. Then do a full-body check for ticks. Remember, Justin, I think Timberlake had that, and it can cause lots of problems for lots of people. So if we can get ahead of this, I think we'll be great.
I don't remember them growing up, but they're obviously a reality now. We got to change.
Yeah, more and more every year.
Yeah. All right. Thank you, Doctor. Appreciate you. And if you have a question for the doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on our Facebook or on X.